welcome to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We have a really important show for you today. We talk about hope, we talk about change, we talk about how love and community are still very powerful and needed forces, and we have some tips for getting together in your community. After that, we look into what's happening with the healthcare crisis that Republicans are causing by taking away our healthcare dollars and how you can help protect healthcare access for everyone. Following that segment, we look at what's happening with education, and after that, we look at what's happening with childcare. Lots of fire alarms are going off, people. We talk about it and we talk solutions. We're going to jump right in with our first guest. Nadine Smith, who's been the longtime executive director and champion with Equality Florida, and who will soon be taking on a new role with Color of Change. Welcome, Nadine.
Thanks for having me. It's good to be back.
I'm so excited that you're back. I'm so excited about all the things that you're doing. And speaking of back, I'm going to go with that word back because you're in a moment where you can look back on the work, the learnings, and the gains from the time you've spent building and growing Equality Florida as you're moving to leadership and color of change. And when you're looking back, what are the big victories that really importantly give you hope for the tomorrow we can build together despite the just absolutely devastating headlines?
Yeah, well, actually, the hope that I get comes from looking back not just on the tenure of 28, plus years doing LGBTQ organizing in Florida, but the history of our country. Looking back on my own family's history, up from slavery to organizing. My grandfather was one of the leaders in the Southern Tenant Farmers Union, organizing sharecroppers. My grandmother was one of the Black Angels, the first Black nurses who had to organize for their own dignity, but also advocate for patients in tuberculosis wards in Staten Island, New York, who'd been left to die. And because they actually cared about the people they were looking after and paid attention, they were actually able to guide researchers toward a cure, toward a way of saving lives. And so the metaphors abound for me in this moment because it calls out for the kind of solidarity that our ancestors had to prioritize in order to survive. And so, as we reel from all of these different events, I do look back and I remember when it was hard for us to form an LGBT organization in Florida because people had to give their first and last names, which meant they had to risk losing their jobs with no recourse. When the idea of having equal access to the protections that marriage provides was as, far away as a hawk to the moon. It was a completely different time. And now we're fighting to hold on to things that when I was growing up and coming into this work weren't even thought of as seriously attainable. So I think it is important, as you say, for people to reflect and to find the hope in the times, the last Gilded Age, where the robber barons were grifting and snatching all the resources they could. The people organized. We collectively fought back, and it was the prelude to a future that was unimaginable under their boot. And so I think right now we have to understand that we are in that Gilded Age again, that we have a government run by mobsters who are robbing everything they can, hand over fist, and for them, the protection racket, their shakedown game, is now global.
I mean, it's appalling. When you
Yeah.
said the shakedown game is now global, I had a moment. I had to like take a little breath and think, I don't want Venezuela. I don't want Cuba. I don't want Canada. I don't want any other country. I don't want Greenland. What I want is healthcare access, childcare, and affordable food. And we have that grift game that you're talking about of going international and worldwide with the President of the United States of America leading that charge and ignoring the contributions and the needs of the American people. And I think it's
Yeah.
really important to say that out loud because our taxpayers, our dollars that we're paying in taxes, we've long prioritized to go to things like healthcare and childcare and roads and access to nutritious food for kids who need it. And yet that is being grifted and used to do things like mega funding for human rights abuses in the name of immigration enforcement, with
Oh, yeah.
ice and global just mayhem. It's awful. What's
Yeah.
your take in this moment?
Well, I mean, I think that's what people have to understand. You have to stop thinking about it as what is this country doing, and understand what is this mob family doing
Mm,
that has seized the assets of this country uh,
mm,
to do their crime.
mm-hmm,
And because then it starts to make sense. They don't care about NATO. They don't care about, alliances, because the only alliance they have is to more money. And so, yeah, if it means, kidnapping the head of Venezuela and informing oil companies before you inform Congress, and setting up a system where one of your MAGA billionaire buddies is about to make incredible money, then you do that because that's what you're driven by. And if we try to think rationally, how should a country act, then we're always going to be confounded. But if we say, what would a mobster do in this circumstance? I guarantee that's what they would do.
mm. That's important thought. And how we get out of it is something that you raised, and that's the power of the people. The power of the people is still more powerful than any person in power. And we have midterm elections coming up. What's your advice to everyone who looks at the headlines and says, oh my goodness, what can I do?
Yeah. Well, listen, the midterms are vital, obviously, absolutely vital. But we also have to understand that telling people to vote without giving them a reason to vote, without giving them the hope that comes along with it, for people for whom life doesn't change election to election, uh, voting is a symptom of whether or not we are delivering on promises to people in a way that makes them think it matters. And so we've got to do the work of organizing communities in ways that help people understand. I'll give you an example. My wife, in our old neighborhood, there was an empty lot, and kids would try to build a playground there, like with an old milk cart and some rope over a tree branch, and so we tried to get funding to get a real playground in a largely black community with very little investment. And we ended up building a community garden by going door to door and telling people we could grow fresh vegetables here, like in this place they call a food desert. Well, people got really excited about that. And when the city tried to shut it down, we were able to organize people, many of whom hadn't been registered to vote until they understood that by registering to vote, their voice would carry differently. And we organized and protected that plot of land, changed the laws about where community gardens could be. And the community owns that garden. They feel excited about that garden. And when people came in and tried to gentrify and divide that community in a way that was clearly along racial lines, the same people who organized to protect that community garden organized to stop them from dividing our community. And so we didn't have to say you have to vote, you have to vote. It was obvious not only that you needed to vote, but that voting actually mattered.
So, this is a message also to those people who are in power or who are running for office. When you're running for office and you make promises, now we know that you can't always keep your promises because it's about math, right? We need to have the majority of a ruling party in order to pass policies oftentimes. But if you are running for office, please connect what you are running for office on with the community, and then please carry through and show us with
Yeah.
what your actions are, not just your words, right? So,
Yeah, and speak clearly to people about what, you know, Mamdani's race,
yeah,
he was not even on the radar screen when he first
yeah,
started. And
yeah,
the people for whom he was on the radar screen saw him largely as a symbolic candidate, but he actually walked the talk. He spoke about the things that people cared about the
yeah,
price of, lunch from your local food truck, or,
yes,
he, and so I would say, it's not just adopt his platform. You don't have to run on free buses,
yep,
but you do have to talk to people about the things that are impacting their daily lives. There's a reason that the Black Panthers launched a free breakfast program,
yep.
because when people are in perpetual survival mode, they can't be in organizing mode. And that is why we are completely inundated day in and day out with these messages that are intended to leave us in a constant state of fear and panic, emotionally dysregulated, curled up in a ball under our desks. And when we don't do that, when we refuse to be terrorized in the face of their terrorism, those are the places where we take back ground.
Yeah. And I really am glad that you brought up Manani because recently he came out with a universal child care pathway. Hello, speaking to my heart and soul. And one of the reasons why speaks even deeper to my heart and soul, and that is he doesn't even have kids. He does not even have children. And he heard at the doors talking to people that the fact that childcare was so outrageously expensive was pushing people out of the labor force and giving people fewer choices about their own lives. And so, through listening to people, he said, okay, we can have a structural solution together childcare. And he's already acting on it. So, I just want to say that is a great example to bring up. And if people want to Google him and childcare, it's in the New York Times right now. It's like really great policy, and it is a moment, a glimmer, a place of hope. What can people do? We only have about 2 minutes left. What is your advice for what everybody who is a thinking human should be doing in the United
Yeah.
States right now?
Well, I'll risk being corny and say connect with your neighbors, be involved. Don't let these be abstract political conversations. We're talking about real people. We're witnessing the aftermath of the horror of ICE killing yet another person in Minneapolis. And what is moving to me is that despite the horror of it, people are still in the streets. They're still confronting ICE. They're not backing down. There's more every day. And we have to be fearless and bold in this moment. And that is what is going to get us through this. Locking arms in dangerous times, looking out for each other. We're supposed to look out for each other and not give in to fear. That's their greatest calling card. And so, at the end of the day, it's love that's going to get us through and solidarity.
And not giving up on love. I think this is what's really important, like persistent love. I don't even know what that's called. Not,
Yeah.
kind of creepy stalker love, but
No,
persistent love.
no, it's like, you know what? I care about people. When I was a reporter, I remember I would cover stories where people had risked their life for a total stranger, put themselves in danger to save someone's life. And you ask them later why, as a reporter, I'd ask them, what made you jump in the water after them? What made you do that thing? And they said, I didn't think. I just did what I knew was right. And that is who we are. And it takes external forces to make us turn our back on our neighbors. And we have to resist that. We have to know that the only way forward is to build the inclusive, multiracial future that has something in it for everybody and not give in to the fear and the nihilism of these money grubbers who are simply looking for ways to divide us against each other so they can line their pockets.
So, everybody, we hope that today, after you read the headlines, your cortisol goes up, take a moment, take a breath, think of someone you love, but also look around and think of somebody who helped somebody who didn't have to. Because if you look around, I guarantee you will find people who are helping people out of the goodness of their hearts. It's not all hate out there, and we can bring together the hope, the heart, and the love and the change by not giving up on one another. Thank you so much, Nadine, for being with us. Thank you for all you do. Thank you for giving me a burst of hope. Thank you.
Take care.
Thank you. We'll be right back with our next guest talking about the attack on healthcare access and how we can help protect healthcare access for everyone. We'll be back in a moment. Welcome back to Breaking Through with me, Kristen Rao Finkbeiner, powered by Moms Rising. We are joined by a wonderful, spectacular, amazing, nation-lifting guest, Felicia Burnett of Moms Rising. Woo! Welcome, Felicia.
Hi, Kristen. Excited to be here.
I'm really excited that you're here because we have some talking to do. And we have some talking to do about healthcare. Healthcare, healthcare, healthcare. There has been a Republican leadership and Donald Trump attack on healthcare that is honestly mystifying to me. And it has been relentless. And it has been going on since Donald Trump took back the White House. And why it is mystifying to me is I will just share we're in the middle of a flu epidemic right now. We have the highest flu rates in 20 years in America. People are sick. Democrats are sick. Republicans are sick. Libertarians are sick. Green Party people are sick. People of all political parties are sick. Yet Republican leaders and Donald Trump have been ripping away health care disproportionately from their own Republican constituents. Am I right? And what's going on?
Yeah, that's absolutely right. The cuts that they made to healthcare last year are absolutely going to disproportionately impact folks that live in rural areas across the country, which are disproportionately Republican areas. Uh, they are trying to hoodwink us right now by saying that they've put extra money into the budget last year to save the rural hospitals, but what they really did was cut hundreds of billions of dollars that's going to impact these rural hospitals and then just gave like a tiny percentage back to try to protect them. So it's actually not going to make much of a difference. They're trying to, get a cookie for that tiny percentage back that they gave, and it's not going to work. We're very concerned about rural hospitals closing and the impact on rural communities, and it's definitely going to disproportionately be impacting rural folks, low-income folks, people with disabilities, older Americans, people across the board. We're really concerned about what these cuts are going to do to families all across the country.
And talking about being really concerned, we've had a series of cuts. So we had in the big ugly bill a giant cut on Medicaid, which horrifyingly, that cut on Medicaid, those funds were used, transferred, and moved to have more ICE enforcement, more human rights abuses in the name of immigration enforcement, more concerning lack of complying with the actual law by ICE. So we moved our healthcare money from healthcare, by we, I mean Republican leaders, by the way, to human rights abuses in the name of immigration enforcement. And that is terrible. So that happened. And then after that, the Republican leaders failed to extend the tax credits for the Affordable Care Act that is making the Affordable Care Act actually affordable. So we're expecting the Affordable Care Act to go up by 70 to 90%. The question is there hope? What could and should happen to fix healthcare in America? And I say this with a caveat. You all, none of us thought that the healthcare system before Republicans wrecked it even more was perfect. We all were already working for more access to affordable healthcare. And then Republicans came in and made it even worse. So sometimes people get confused. They're like, oh, you loved the healthcare system. You thought it was perfect. No, it wasn't perfect. We were working to make the healthcare system better before it got undermined and totally, money sucked out of it. And now it's in an even worse state that needs even more fixing. So what the heck is happening in terms of how we can fix it, Felicia?
Yeah, absolutely. Well, first, to go back to your first question, there is hope. In December, four Republicans joined with Democrats to force a vote on a 3-year clean extension of the expiring ACA subsidies. Now we are, looking forward to that. We'll still have to get it through the Senate and onto the president's desk, where hopefully he would sign it after both, layers of Congress have sent it to him. So that is one step. That is hope going in the right direction, but it is really just a first step. What we need to happen is to restore the funding for the ACA subsidies. We need to restore funding for Medicaid, and then we need to start taking meaningful action to improve our healthcare system, lower healthcare costs, including prescription drug costs, and make healthcare affordable and available to everyone in the United States of America. We are the richest country in the world, and so for anybody in our country to come here or who lives here to be sick and not be able to see a doctor when they get sick, when they get the flu during the biggest flu, the worst flu season in several years, is ridiculous. We need to be able to have folks in our community be able to see a doctor when they get sick and not to have it bankrupt them or put them in debt for several years just to pay off a small medical, what should be a small medical bill for getting treatment when you're sick.
And so there's a lot of complicated things happening with healthcare because healthcare is under attack by Republicans in Congress from a number of different angles. I can't even believe it. I'm like, what?
Right.
You all get sick too. What's happening? But anyway, so what should people say when they call their member of Congress? How should they say that they expect their member of Congress to fix this problem?
So we know that Congress has a lot, especially right now, Republicans in Congress have a lot of kind of wacky ideas on what they need to do to fix healthcare. Most of them aren't going to work. A lot of them actually are proposing to increase costs for America's families. One of the proposals is to get rid of $0 premiums for folks on the marketplace who qualify for $0 premiums because mysteriously they want to make sure that like everybody has to pay something, even if you qualify for that $0 plan. They actually are seeking to increase costs for families' healthcare. And a number of their other proposals will do the exact same thing. You'll hear a lot of things about increased HSAs, even though we already have 25 types of HSAs. You'll hear all kinds of proposals, but what they need to do is they need to call their members, what you need to do, you need to call your members of Congress. You need to tell them that you support an extension, if not making permanent, the ACA tax credits. And in addition, since there's only 1 week left, like just a few days left in the open enrollment period, and they've waited so long, they need to include an extension of open enrollment so that folks who logged on at the beginning of open enrollment responsibly to see what their healthcare options were before the end of the year have the chance to actually log on and see once things are passed, once the ACA tax credits are passed, what their true price will be. So
Yep.
many logged on, they saw that they're just not going to be able to afford it because Congress did not act before open enrollment started. And they decided not to sign up for health insurance, to forego health insurance altogether, or they signed up for a much less comprehensive plan than what they actually needed for their healthcare needs, just so that they could afford the premiums without these tax credits. Congress, especially Republican leaders in Congress, love to tout how much they love tax credits, tax credits, tax credits, only for their billionaire besties. Now, the American people and families, we need tax credits for our health care, and it's time that they stand by their commitment to tax credits and extend the ACA tax credits. So you need to call your members of Congress and let them know that you support extending the ACA tax credits.
150%. Now, people, I have some startling news. I believe that we will win. I don't know that we're going to win today. I don't know that we're going to win tomorrow. But as Felicia said, we're one of the only industrialized nations without nearly universal access to affordable health care. And everybody gets sick. It doesn't matter who you vote for, you're still going to possibly get the flu or, maybe break a leg. Unfortunately, hopefully you don't break a leg anytime soon, or have some type of unanticipated health situation. And so this issue area I think is really important, is that it is not political outside of the Beltway. Healthcare is something that everybody needs as a human right. And inside the Beltway, healthcare is being used as a political football. But outside the Beltway, healthcare is used to breathe, to live, to go to work, to thrive. And I just think that because of that, because Republican leadership inside the Beltway are so out of step with the polling and the needs of the Republican constituents inside their constituency areas, that we will win. What do you think? Do you think we're going to win?
Absolutely. I have been in this healthcare fight for a very long time. We are definitely going to win. You're right. It might not be today or tomorrow or next week or next month, but like you said, everybody needs healthcare. Everybody gets sick. These Band-Aid solutions that they're suggesting, just this week they said, well, just eat healthy, and then you'll have no health problems. Like that's not a solution for healthcare. Everybody gets sick. Everybody is susceptible to a virus, especially when they're changing guidelines that encourage people to eat less healthfully and not based on science. They're actually, not only attacking our healthcare, but our public health at the same time and making people sicker while taking away their health care. And I think that unfortunately is going to cost a lot of lives. It's going to cost a lot of livelihood. Uh, but in the end, folks are going to wake up and see that the proposals are not good for our families, they're not good for our economy, they're not good for our communities, and we are definitely going to win and move this country forward to a more healthy, healthful society.
And speaking of which, there's not only, as you just mentioned, an attack on our healthcare system, on our access to be able to go to doctors, but also on our public health. So I feel like we should take a moment to say, hello, people. Studies are showing that we do have right now the highest rate of flu in our communities in 25 years. If you have not been vaccinated yet, please go get vaccinated. Vaccines work. Vaccines save lives. They might not prevent you from getting this really bad flu A variant, but they most certainly can help it not be so bad and keep you out of the hospital. So make sure that you check with your doctor about vaccines, that you check with your pharmacist about vaccines, and that you take advantage of the vaccines around us. And do you want to say anything about vaccines, Felicia, while we're talking about it?
Yeah, especially this flu vaccine. We've had an unprecedented number of children this year die from flu. We need not while you're going to get your flu vaccine, make sure also that you bring your children to get their flu vaccine. Encourage your children to get your grandchildren their flu vaccine. Make sure that your whole family is protected at all ages, because there's been an unprecedented increase in hospitalizations and deaths from this flu. And so it's very important to get your flu vaccine and all of your other vaccinations that have been recommended literally for decades by our scientific institutions and not influenced by politics, as has recently been happening. Make sure that you get you and your kids covered and vaccinated to protect your family and your community. Vaccinations don't just protect you and your kids. Vaccinations help protect those who are most vulnerable in your community who cannot get vaccinated. And if I could just share a personal story, a personal experience. When my son was born, he had to start chemotherapy at 6 weeks old. And as we all know, when babies are born, that's when they start getting vaccinations. So we had to immediately stop giving him any vaccinations. He was not able to have vaccinations for the first 2 years of his life while he was undergoing chemotherapy. So not only did he not have vaccinations, but then he was also immunocompromised from the chemotherapy. And it was the choice of my friends getting their children vaccinated that protected my child until he was able to get his vaccinations up to current after he went through chemotherapy and was better. So it is really important not only to get you and your children vaccinated, not just for your family's health, but to protect those in your community who can't get vaccinated for whatever reason or who have to delay vaccination, to make sure that we are caring not just for us and ourselves, but our community as a whole.
And studies are showing that even if there isn't a direct match to the current flu circulating in the flu vaccine, that getting the flu vaccine cuts the risk of kids having to go to the emergency room or be hospitalized by 75% and reduce the same risks for adults between 30 and 40%. So even if it isn't a direct match, it does help keep people and children out of the hospital and people alive. So you all, don't listen to the hype, listen to the science. Make sure that you go ahead and get that flu vaccine. And I'm also hearing even if you've had the flu, because there's a number of strains in the flu vaccine that you can be protected from if you've had one of the flus. So still get the flu vaccine after you've recovered from having the flu if you have it right now. And I hope everybody is as healthy as possible. Call your member of Congress, tell them to support healthcare. And thank you so much, Felicia.
Great. Thanks so much for having me, Kristen.
Next up, education. What's happening in our education system and how you can get involved. We are joined by an amazing, spectacular, wonderful guest, Dr. Kim Pinkney. She is a founder with KP Solutions and Consulting. Welcome, welcome, welcome.
Thank you so much. I'm super excited to be here. And thank you, Kristen, for all the work you do with this podcast. I'm excited to be a part of it.
I'm so thrilled that you're here because there is a lot of strange things, bad
Yeah.
things, not good things happening
Yeah.
with education and education access for our K through 12 children. I'm
That's right.
wondering, many of us are just coming back from a holiday break where kids were out of school and, maybe not thinking about school that much. But
Sure.
now that we're back in school, now that 2026 has started, what the noodle is going on?
Well, I mean, that's a good question, right? What the noodle is going on. I do feel like I was just saying after the break, that's this sort of new year feels like kind of a slap in the face. And I think that prior to the holidays, we had like, oh, the holidays are coming up, but now it feels like reality, right? Like we're let's revisit the fact that what are we doing in terms of education? Are we really making decisions and policies and directives and laws that are really supporting the infrastructure that we really need in education? And it causes me to go back to what we're doing with the dismantling of certain departments in the Department of Ed. Like, what is that really about, right? So we no longer have this veil of like the holidays or whatever to kind of gloss over it. I feel like the distractions are kind of removing themselves. And I think the reality of and the severity of what's going on, both federally and at the state level, is really starting to impact folks. So I think we have to revisit and get serious about it.
What ways should we get serious about it? We know that in particular, access to learning opportunities for kids with learning differences is under attack, which can I just say is the
Mhm.
most ridiculous, harmful, and bad thing, not just for the kids,
Absolutely.
but for the parents, for the families, for the communities, for our businesses, for our economy. The
That's exactly
amount
right.
of lost innovation, lost opportunity when we kick
That's
kids
right.
out is ridiculous. So, what's happening with that right now?
So I think to answer your first question of like, what do we do to get serious about it? I think we have to first get clear. So let's get clear about who deserves to be in our schools, number one. And that is any kid that shows up in a neighborhood, right? And with that, we have to then embrace the fullness of humanity, that humanity doesn't just include gifted and talented. It doesn't just include your average student, it includes students that show up in any way they do. So the neurodivergent population, those who are deaf, those who are blind, those who have physical disabilities, everyone. And I think if we really embrace that and see that as the core of our work in education, then we really have to call out what do we mean we're dismantling departments and Department of Ed and really look at, wait, so this is essentially not just cutting red tape. And just for the record, I am a former government employee. And yes, there is some red tape that happens in bureaucracy. Absolutely. But in effect, what really is happening is a defunding and stripping away of Part D of funding, right? Which really is what's going towards teacher preparation programs that really impacts our special educators and those specialists that provide services like speech therapy and occupational therapy and all of those things that all of our kiddos need. And it's also affecting parent training, right? So these centers, I've had the journey, right? I'm also a mom of a kiddo who is neurodivergent, and we've lived in 3 different states. So I have experience in Maryland and Pennsylvania and New Jersey. And so these parent centers, training centers like Parents Place of Maryland in Maryland, Peel in Pennsylvania, and Span here in New Jersey, the funding comes from that, from Part D, right? So we really have to look at like and distinguish between like the lip service and the actuality of what's really happening. So we're really disenfranchising parents through this, which are a part of that school ecosystem. And of course, it's going to affect those who are underserved, under-resourced the most.
Yeah. And one of the things you said is that, we don't just serve some types of students. And
That's right.
in that, which I think is really important, is that many types of students are many types of students at the same time. There is
That's
no
exactly right.
single type of average student
That's
right
right.
now. I
That's
mean, like
right.
people are complicated, right? So if you have
That's right.
somebody who has a learning difference, they might also be in the gifted and talented program. That's the
That's
same
exactly right.
kid. And so when
Mhm.
we don't do the parent training, when we don't do the teacher training, when we don't do the community training, when we don't do the embracing of the marvelous learning styles of the people
Yeah,
who are in our planet or on
that's
our
exactly
planet,
right.
then again we lose out because all of that innovative thinking that comes from not necessarily coming at a problem
Yeah,
with the same angle of solution, which
that's
of
right.
course we need. Look around
Of
us, we need
course.
lots of solutions.
Right.
And we need innovative solutions, gets thrown out the door when kids get locked out. And the other thing I think that was really important that you mentioned is the parent training. We just briefly blipped over that. But, parents are with their kids the most of the time.
That's right.
And so having parents be trained on learning opportunities, learning avenues, and even behavioral modifications is super important. And so when you don't
It
have that,
is.
then
It
the
is
whole
super
community,
important.
school has to work harder. Yeah, what's your thoughts?
My thought, several things. Like, thank you for lifting up the things that you did lift up because, yes, absolutely. This world, it takes all of us. Anything we want to achieve, it takes all of us. And what are we losing out on? The potential of, the risk of unlaunched and untapped potential in anyone.
Yep.
And when we cut that training for parents, right, it disenfranchises them from having an actual seat at the table. So if
Yep.
you're at an IEP meeting or if you're at a parent-teacher conference, you can't then show up as a full participant with all of the tools that you need in your toolbox, right? Because you're then disenfranchised, you haven't got the training, you don't have the access. And then you also can't advocate for your child or even properly, right? Both within the school system and then within the community. Because I think sometimes we forget that like students are just students in the school. Like, no, they're also community members, right? They're in activities with other kids or parts of the community. And so it really has a far reach. And I think the other thing is I don't want folks to be disillusioned. Like did we have it right before? No, right? It's been the 50 year sort of celebration of IDEA or IDEA. And we know that like that promised about 40% of funding that was going to cover special education costs. And we never achieved that in actuality. So we were already underfunding and underdelivering on the promise. So when we then start to dismantle other aspects of it, it really is gutting an entire system, and it's pretty serious.
What successes have you seen because people did have access to learning opportunities that were maybe not totally conventional learning opportunities from a standardized classroom?
Sure. So I'll talk about sort of some experiences that I've had with my son. Um, in the earlier years, right, through like Child Find, it was in Maryland, where you could kind of get early intervention services. He had this really great opportunity to then participate in like a preschool program that so many things, like from a community involvement perspective, he was able to start riding a school bus right at the age of 3 to like get that experience and figure out what that was and really get into a school system and in that type of environment. And because of that early access and that opportunity helped to foster his language, his social skills, but then comfortability to be able to participate in the community, right? So by the time he was school aged, and I'm using air quotes for that, by the time he was actually school aged, it was not a huge mountain to overcome, right? He had already been prepped and primed and sort of had developed some skills to set him up for success at that level for kindergarten. So that's one of those opportunities that I think about. And I also think about, I recently attended SPAN here in New Jersey hosts a conference for parents specifically. And this is where they're willing to, for you, break down like what is an IEP? What
Mm,
what are the components? What does that even mean? What are all of these acronyms that people are using,
mm,
right? And so that particular conference serves the parents to empower them, but then that also helps the students, right, as a success because those parents are more informed and have a better seat at the table than they did prior to that. So I think that you just really can't underplay and undervalue how important those types of things are.
I
Access,
agree.
early access, and then the training is really, really key.
Yep. And let's talk about the IEPs. Let's demystify the IEPs for a minute.
Do
Let's
it.
go
Let's do
into
it.
this. Let's go into
Okay.
this because
Mhm.
the IEPs are a thing of beauty, you all.
They
So,
are
what
something.
IEPs are is you have an assessment of the student. The
Hmm.
assessment figures out where there may be barriers to being able to learn and where there may be opportunities to be able to learn,
Hmm.
and has some tips and tactics for how this particular student can learn better. So
Hmm.
imagine in a time without an IEP, and I'm going to go to like some extreme nonsensical
Sure. Do
examples.
it.
You could have a student walk into the room who could have no hearing and no sight, and you would only be teaching that person with a chalkboard and talking.
That's
There
right.
is no way that that person could get that information. So the expectation would be that from the teacher in the classroom that this student would learn from
Hmm.
hearing and seeing. But actually, the IEP would disclose that this student, it's an impossibility for this student to learn
That's
from
right.
hearing and seeing. And so, hey, how about something else? Maybe Braille, right?
Right.
So
Mhm.
that is an example of a way to work around and learn about what's in your classroom. Before
That's right.
we had IEPs, teachers would come to school, there'd be a whole classroom of kids, and you'd have to guess.
Mhm.
Does this child have the ability to see or hear? Does this child have the ability to learn in this way or that way?
Mhm.
Does this child have the ability to do these certain tasks? Or am I expecting the impossible?
That's
And
right.
so there's that. It gets rid of the mystery for teachers. That's really good. But then the second part is it gives some solutions. And I think this is part of what you're talking about today, which is those deep resources for alternative learning methodologies that do not necessarily take any more time. that do not necessarily take any more money,
That's right.
do not
That's right.
necessarily take any more resources or take anything away from anybody in the classroom,
That's right.
but allow a student to express themselves that they are doing their learning and to
That's
take
right.
in the learning. And so I think IEPs are magical. I think
Mhm.
IEPs are magical because they take out the mystery of what's happening with the students. You don't have to
That's
guess.
right.
You don't have to get mad at somebody
Mm-mm.
because they can't do something.
And you don't have to throw them out of the classroom because, well,
Yes.
I put the chalk up on the board and it didn't work, so they can't be here, right?
Yeah, so they can be
Yeah,
there. They just need a different methodology of learning.
that's
And I
exactly
have
right.
seen it work so well. So, for
Amazing.
example, in my family, we have somebody with dysgraphia. And so, what that means is those little bubble
That's
sheets
right.
you have to do,
I
they
was
are
just
an
going to talk about that.
impossibility. You're
Hmm.
not going to put a pencil in the hand of a kid with
No.
dysgraphia and have them fill out a bubble sheet. It's just
Or
not going
with
to happen.
visual processing differences.
Yeah,
Right?
it's just,
No, that's not going to work. Hmm.
yeah. So, the answer, I got to tell you, costs $0.
Hmm.
Circle the answer in the test booklet.
Correct.
That's it. Circle the answer,
Correct.
right? And
Correct.
so that difference opens up the ability for a kid to stay in a classroom, to
Yes,
stay on grade level, to show
that's
that they
right.
understand what's going on. And that comes from having things like IEPs. And so
That's right.
sometimes I feel like IEPs get a bad name. But I'm like,
Hmm.
I love a good IEP. Like, hello, this
Yeah,
is
a
the
good one. Absolutely. Right.
barrier
We have
and
to
this is
do.
opportunity, you know? What do
Yes,
you
I
think?
love that example that you gave because I think part of what has to happen is a demystification of what we're talking about. Oh, there are these kids that have too many like needs and it's hard to sure, there's frustration in every profession. Absolutely. I don't want to like downplay that. But when we're talking about something as simple as allowing a kid to circle an answer in a test booklet, or for visual processing, printing it out, printing something out on a slightly larger piece of paper with a larger font. And if that's going to make that particular content more accessible to that student, if we're talking about, ensuring that a student sort of writes down their homework for the week. If we're talking about a graphic organizer, either things that are not heavy lifts or that are just sound instructional practices that any and every kid would benefit from,
Yep.
right? So they're typically, so I've also been a classroom teacher. I was a Spanish teacher in a middle school, and I had students with IEPs, and I was not a special educator. But when I would read IEPs and would read the accommodations that were listed, it was very clear. Oh my goodness, guess what? This is necessary for this student, but who else is it going to benefit? Every other student in my classroom.
Yep,
Right?
exactly.
Everybody wins when we try to accommodate and proactively account for who really is going to show up in the classroom. So I
I
love that you
totally agree.
highlighted that.
I totally agree. Okay, so we only have a couple of seconds left.
Sure.
Should people call their member of Congress and say, save the Department of Education?
Okay, well, absolutely. They should call all the people, right? I think it first starts with reaching out to those parent centers that I mentioned to show your support and ask them if you can jump on any campaigns that they have. So in the state of Pennsylvania, that's Peel. In Maryland, it's Parents Place of Maryland, and in New Jersey, it's SPAN. I think you also need to contact your state representatives to sort of let them know of your support and also contact your federal, your senators and all of that because your voice matters. And the more that we realize the severity and put our voices behind it, the more that folks will understand that the impact is dire.
Thank you so much for being on. Thanks for
Thank
all
you.
you do. Thank you. Thank you.
Thank you so much.
Thank you. Next up, childcare, which is oddly being used as a political football by the far right. Find out why and how in a moment. We are joined right now by an amazing national and local and everywhere leader, Lauren Hipp of Moms Rising. And Lauren, I'm really excited that you're here today because we are going to talk childcare. And people, childcare is in the headlines right now, but not for the right reason. So we need to talk childcare. Welcome, Lauren.
Thanks for having me.
I'm really glad you're here. So we have had attack after attack on childcare. Hello, this is confusing. Childcare is not controversial. Childcare is something that parents of all political persuasions need to be able to go to work. Kids of all political families need to be able to thrive. And childcare workers need living wages to be able to stay in their profession. And businesses need childcare too, because we can't have people in the labor force without some place for their kids to learn, grow, and thrive. So childcare, study after study shows, is not just a win-win-win-win-win when we think about it. It's a win-win-win-win-win when we run the numbers. The return on investment is sky high to our communities, and yet childcare is somehow controversial right now under the Trump administration. And they're making it even more so controversial and using childcare oddly as a wedge to pitch communities against each other. What is happening?
Such a good question. I do feel like more and more we live in the twilight zone, and it does feel very confusing right now. But essentially, what is going on is that, first of all, we've had years of the work of the alt-right to kind of create poison in the water around sowing distrust and mistrust in our communities and in public systems. And this is building on top of that toward their agenda in Project 2025. So none of this is necessarily surprising, and they've been working at it for a while. And what they've done is they've manufactured their own crisis to further their really hateful and harmful agenda for families across the country. And as you laid out, like for businesses, for our economy, childcare is something that is foundational for all of us, whether or not we use it. So what this started was a little YouTuber guy, creepily, thought he was going to go and uncover some quote unquote fraud, some unsubstantiated claims of fraud in Minnesota, and went door to door in a Somali neighborhood to Somali family childcares, trying to prove that they weren't actually doing what they said that they were doing in terms of providing care for children. Now, I don't know a single childcare provider, I don't know a single parent who would open a door to a strange man trying to film them, asking to see the children in their care. That's a non-starter. That is creepy. That is weird. That has the potential to be extremely dangerous. He posted his video on his YouTube. It was retweeted by the vice president and others within the administration, and it went viral. And these are unsubstantiated claims. And the claims that were around fraud had been dealt with in 2019 through the normal legal process that is set up. But facts apparently don't matter in this viral environment, and the administration used that as an opportunity to create a wedge, to continue to otherize our immigrant neighbors, care providers, part of our care workforce, and demonize the Somali community and accuse them of things that are completely unsubstantiated, and then use that as an opportunity to pull out funding, to freeze funding for childcare for families in Minnesota, punishing children and families at a time when families need access to affordable childcare. Like, families are asking for things like childcare and healthcare. They're not asking for chaos, but what are we getting? We're getting chaos, and we're getting harm to our families, to our communities, and our economy. And that has now escalated, and he has issued a freeze across all 50 states around childcare, and has issued a direct threat to 5 states in particular, 5 blue states who have Democratic governors, whose governor offices are up for election this year, and has frozen access to funds for childcare, for things like cash assistance and other programs that really ensure that families are able to survive and to thrive. So he is attacking childcare. He's attacking families and our basic ability to live and survive. This is politicized in order to be able to continue his really hateful and harmful agenda of denaturalization and deporting our friends and our neighbors and our community members, and to destabilize our trust in public services, and ultimately to defund our systems of care. Childcare is at the heart of this, and it's a really trying time for families, and to be used as a pawn in his overall scheme to wreak havoc on American communities.
Yeah, I mean, it's really, really, I don't want to say sad. It's a sad time in America. Because let's go back to the basics, to the foundation of where we are right now. In the United States of America, under Donald Trump, costs are skyrocketing. The price of eggs is still going up. We've had coffee go up 33%. The price of washing machines, appliances are going up. The price of basically everything is going up, and everything includes also childcare. Those costs are going up. So families are really having a hard time right now. And in that context, we know that 3/4 of families need the wages of moms to make ends meet, to put that expensive food on the table, to make sure that kids have the right size sneakers so that they can go run around outside comfortably in recess, to make sure that they can pay for rent or a roof over their head. People need the wages of moms to make ends meet. I don't know how many times I can say that. People need the wages of moms to make ends meet. And yet, we have one of the only ways that moms can actually go to work and kids can thrive and we can have vibrant communities, which is access to affordable, high quality childcare, being undermined by the President of the United States of America and also by Republican leaders in Congress. It is so ridiculous. It is so out of touch. I mean, the man apparently has a golden toilet and golden faucets and golden everything. So maybe he is that out of touch that he doesn't realize that, hello, we need to go to work to put food on the table, and kids need a safe, enriching place to be while we go to work. And that is the best of all worlds, a spectacular childcare opportunity, an early learning opportunity. So we have Republicans and Donald Trump undermining childcare, using childcare as a political football, when it's actually one of the basic components of infrastructure that would make America work for working families. And that to me, Lauren, is so hard for me to understand. How could they do that? How could they undermine their own constituents? How could they undermine America? Because there's also this weird idea going around that, parents should only be, moms in particular, only be out of the labor force, and only be at home with kids. And that would be a great choice to be able to have, but not everybody, in fact, most people don't have that choice. So what are your thoughts on that weird culture war aspect of the situation?
Yeah, I think they're really seizing upon this idea of parents having choice, and weaponizing it because absolutely, we all agree that parents should have choice. We all agree that the role of parents and of close-in caregivers is so important to our children, to our communities, and we want to make sure that families have what they need to be able to be there in those early years to ensure that we're setting a beautiful foundation for children and for families to thrive. But
Yeah.
what they're sidestepping is that it takes a lot more to be able to ensure that parents actually have choice. There aren't many parents that have the choice to say whether they want to stay home or not. It requires two incomes to be able to try and make ends meet. As you laid out, like costs are increasing across the board. Childcare is incredibly expensive. It is very expensive to buy food right now. It is very expensive to afford healthcare if you are so lucky. And there are so many reasons and barriers where parents don't actually have the choice. So if, it would be great if we had a policy context where we were giving parents and families that opportunity to choose, but right now they're ripping those things away from families. If you look at the 5 states where he has chosen to freeze funding to blue states because apparently he thinks that childcare only impacts along political lines. There's new analysis out from the Century Foundation that shows that more than 500,000 children in over 44,000 programs could be impacted by this. The aggregate cost to families could total more than $400 million annually in lost parental earnings and other impacts. These are massive impacts to families at their, kitchen tables. These are massive impacts to local communities that depend on having the workforce there and the childcare programs open to care for the children. And we know that children having access to stable care is incredibly important to their growth and development. And what is Trump doing? He's slashing and burning all of that for political gain. He does not care about the well-being of children and families, and is allowing these devastating impacts to happen on his watch to further his agenda.
I know, it's so ridiculous. It's so painful to watch happen because we're looking at a president who is utilizing an attention economy, not an information economy, but an attention economy to divide communities. And there is so much misinformation and disinformation in the attention economy because it's not about actual information. It's about what will spark somebody to go, ah. And, that's no way to live. We don't want to go around going, ah, all the time. We want to be able to have safe, orderly lives where we can take care of our children with consistency and we can have choices. And I want to go back to this choices. When you take away access to childcare, you take away parent choice. You push people out of much needed jobs. And then people often go into poverty spirals from which it is very hard to recover, ending up with food insecurity, ending up with housing insecurity, ending up with kids who aren't able to thrive as much. So I don't know how the far right somehow managed to try to frame childcare access as no choice. But I think you and I, Lauren, can agree that childcare gives people opportunity and choice, gives people the ability to have the choice if they want to be able to go to work, to put food on the table, how much time they're going to be at work, all of those things. What is your thought on childcare and parent choice and what it gives parents the choice to do in their lives?
Access to affordable childcare that is meeting the needs of families is absolutely an opportunity and choice for family. Like that allows families to make all kinds of other decisions and agency over the way that they are going to raise their children. There is nothing more intimate and more important to a family than to decide how to raise their child. And their care setup is in that circle, right? However you choose to have care, whether that's family, friend, and neighbor care, or grandma, or you stay at home, or your child is in a center down the street, full of people that you know and you love and are part of your community. That is such a personal choice. And ensuring that we have a system that allows families to make that choice, is so important. It's so important to self-determination and to ensuring that parents have that really important choice about how their children are raised. So the childcare is entirely about parent choice, but the way that the Trump administration is going about it is making it look like we are taking away choice from families, when the reality is that families are asking for more affordable childcare, so they have uh, more choice, right, in how they build their lives and how they set up, how they work, how they go to school, what time they're able to be home. And the more that we're able to put in policies and linked policies like paid family and medical leave and paid sick days, the better off parents are going to be and the more real choice that they will have to decide where they're going to be, right? And it only takes one day of lost childcare to lose your job at this point in this country. So the Trump administration, by attacking childcare in the way that it is and politicizing it, is really forcing parents out of a choice and
And out of
forcing parents
jobs.
out of jobs and into positions that no child should have to be subjected to. No parent should have to make a choice between food on the table or paying rent. And if you lose your job and you lose your income, you're forced into these really terrible situations that could be entirely avoided if you were not wreaking havoc on policies that really mean something to American families.
So, what can people do? We don't have a lot of time left and we need a lot of action. What can people do right now to help protect childcare and stop this disaster?
Absolutely. Call your congressional representatives, share your stories, talk to your friends and your neighbors about what is happening, what childcare means to you. Have them share their stories, whether that's with each other in communities. We need people talking about this. Talk to the media. Call your member of Congress. Call your state representatives. Tell them why it matters to have access to childcare funds and that the federal government needs to step back into its duties and unfreeze these funds immediately and get back to the work of governing and doing the work of the people.
Yeah, doing the work of the people. Like, let's talk about this for a second. Those tax dollars are our tax dollars. They are not Donald Trump's tax dollars. They're not Republican leaders in Congress's tax dollars. They're our tax dollars. And over time, time after time, taxpayers, that's me, you, and us, have prioritized things like funding access to affordable childcare, funding healthcare, funding schools, funding roads, funding clean water. Hello, we need all of these things. People are having their choice taken away and their tax dollars taken away. And I am so mad. So everybody, I want to make sure that you listen to Lauren. And Lauren, we have 2 minutes left. Do you have any closing items?
Stay hopeful. We can win this. We will win this. There are more of us than there are of them. And the more that we use our voices together, the better off we're all going to be. So hang in there, everyone. Thank you for the work you're doing and for sharing your voices. We've got this.
Thank you. Thank you.
Thank you.
That's it for our show today. Thanks so much for tuning in as we tackle the top topics facing our nation in a way that requires the most boring disclaimer in the history of the planet Earth. Here goes. Views expressed on this show are those of the individual speakers and should not be attributed to Moms Rising, to this station, or to any news or social media service that may disseminate a recording of this show to the public or to any segment of the public. Boom! We'll catch you next week. We're going to take a moment away from our conversation about is it education? It's the third one or the second one?
Third one. No, it's the second one. Sorry.
Okay.
Yeah.
We're going to take a moment away from our conversation about healthcare with Felicia just for a quick break, and then we'll catch up where we left off. We're catching up in our conversation with Felicia about healthcare. Thanks for sticking with us.